In the state of California, health officials and authorities are warning that citizens may soon be asked to shelter in place. I also finished watching the New York press conference in which Mayor de Blasio, along with other officials there, warned that the citizens need to fill their prescriptions up now because shortages are coming. They even discussed the fact that the homeless may be brought in under police orders and sheltered in place. We have to watch what is being called an evolving situation on COVID and what is going to happen here in the near future. The Pentagon today, the U.S. military, is warning that the Pentagon has plans in order to shelter in place. Again, all the source links to each one of these stories is in the first pinned comment of this video. Make sure that you go look for that. The U.S. Defense Secretary said on Thursday that he expected the Pentagon to be able to keep carrying out its core functions in the event that this outbreak does worsen, as officials warn that it will. We have a lot of capabilities in this building, he says. Our National Military Command Center has the capability to go for weeks at a time if there is a lockdown. Moving on, hospitals across the country, including San Jose Hospital, is prepping what they are calling surge tents for an influx of cases. The tan-colored tents are currently erected on the southern border of the hospital's property facing Samaritan Drive, directly adjacent to the emergency room. These tents, they say, will be used to screen and house, isolate, quarantine suspected and confirmed cases. The inside of one of the tents shows that they are prepared to be a key strategy in keeping this outbreak as limited as possible. Vice President Mike Pence acknowledged on Thursday that we don't have enough tests in the United States of America, and you'll have to excuse me, it's a very windy day today. We don't have enough tests in the U.S., in the country of the United States, to handle how many diseases are out there. So when you see confirmed cases, when you see officials saying that there are X number of cases in their state, you can bet that there is a multitude more than that. You can multiply that because there aren't enough test kits to show how many people are infected. New York has issued a commissioner's order that mandates any city workers, including healthcare workers and educators, will be forced under law to take a COVID test before returning to the general public. This will be going on. This is according to the press conference today. This will be going on for months. Any information that you hear saying this will be over in weeks, it'll be over by spring, is a lie to you. There are no indications that this will be over. And we're going to talk today about what you can do if you get sick or a member of your family gets sick. In San Diego, AT&T employees, the AT&T has closed 6 retail stores after an employee is presumed to be positive for this disease. What do you see happening here now that we have experienced community spread is that one individual, especially in a retail environment like this, as long as they are within 6 feet of another person, they are spreading this disease to other people merely through the droplets that they expel by using P's and S's and normal verbiage. Just talking to another person, if you were standing within this distance to me right now and I had this disease, you would get infected because you're close enough to breathe it in which your airways take it in, to possibly get droplets into your eye. You take a deep breath in, and even if you're avoiding keeping your mouth open, you take a deep breath in, it goes into your nasal lining, you get infected. We're looking at a potential surge in cases here that will continue on this exponential level. As soon as this virus came out, virologists, pathologists, everybody who looked at it said we go from 50 to 500 in days. We can go from 50 to 5,000 in mere weeks. This is on an exponential increase. It's on an exponential spread, and we have to watch it. We have to each consider at what point do we not become part of that spread. A lot of people have concern, and those concerns were brought up in these press conferences today where the authorities said we're asking employers to be lenient. They stopped short of asking them to pay for people to stay home sick, but said that those types of measures may be necessary here in the near future. Washington County recommends that all 2.2 million residents work from home. If you are able to, they are saying you need to be at home. Do not be out spreading this disease. They're telling all over 60s to stay indoors. A Washington State county where 31 cases and 10 deaths, I believe today, have been reported, is asking all individuals to work from home. We're encouraging employers to maximize telecommuting, they say, and make it possible for employees who can work from home to do so. Communities need to stop large gatherings. Amazon employees are sick, tech industry employees are sick. The nurses union says that 80 members around the United States are under self-quarantine, so watch how quickly this can progress. Nurses and doctors are being told by their higher-ups, their hospital managers, that nothing indicates right now that they need to be in full PPE gear for their entire workday, and yet they're getting sick. Obviously, this level of community spread is not protecting those on the front line that stand between life and death for you. If you get into a car accident, if you have a heart attack, if you have some sort of cardiac emergency, say you have a intestinal problem, whatever it is, these people stand on the front line between death and life. And so if they are not given the precautionary measures to keep themselves safe, what do? They get sick. They go into quarantine. Now a hospital suddenly has 60 less nurses. How do they handle that? That's the type of accident that we see driving this force and making it worse for the entire world. When we are quarantined, we're not only prevented from caring for our positive cases, they say, but also taken away from caring for our cancer patients, our cardiac patients, our premature babies. Nurses need to be protected so that we can care for all of our patients when they need us. This is going to get worse. Don't let anyone say otherwise to you. What no one talks about when they say things like currently low risk, what no one talks about when they say that right now we're not seeing this, is that there's an invisible line, an invisible demarcation line. That invisible line, no one knows when it's going to be crossed, but at some point, because there's forward motion, imagine being on a train and they say that, well, we're not off the bridge yet, but that train just keeps on going forward. No one at the back of the train can see where the end of the bridge is. They have a chance to jump off right now. They might live by jumping off, they might not. They might be safe by jumping off. They might tuck and roll and everything's fine. But they can't see the edge of that bridge. But yet, the person at the helm, the person at the front of that train is saying, right now you're at low risk. Well, sure you are. You're at a lower risk by not jumping off the train than if you were to. But there's an invisible line. The people at the back of the line, the citizens, that's you and me, we're the people at the back of this train. We can't see the point where it goes from low risk to way past danger. We can't see where it goes from low risk to it's already too late. And that's what they're not telling you. It's low risk right now. That means if you, and as an individual, are to go and talk with 6 people, your chance of catching that disease today is low. The chance of everyone having it that you talk to, and so they're spreading it to you, is low. But there's an invisible line, and no one knows when that line will be crossed. So you, as an individual, a free-thinking, a free-willed person, have to take the advice of health officials and decide when it's time to stay home. Decide when you're going to self-isolate, when you're going to self-quarantine. Do you have enough canned food? And I was just talking with a good friend of Kelly and mine. Do you have canned food? If not, today is the day to go get it. They just purchased rice. Do you have rice? If not, today is the day to go get it. Large chains are already enacting limits. They're already rationing their goods. Rationing toilet paper, rationing canned meat, rationing canned vegetables, rationing rice. Each customer is limited to only purchasing a certain amount. Today is the day for you to get it, because soon that limit 10 per person or that limit 5 per person is going to become a limit 1 per person. And so that means you're going to have to expose yourself twice just to get the amount of rice that you could have got 5 days ago. So please take that initiative. Take what the officials are saying. They're saying be prepared to be told to shelter in place as an entire state. They're saying be prepared to get all of your prescription medications filled, because be prepared for a time when you're not able to. Be prepared to listen to the military on your streets telling you what to do. Be prepared to have test kits dropped off by authorities at your doorstep, and then them come pick up these test kits and tell you when you need to go to a quarantine camp. You have to take the initiative now to make sure that you're not placed into one of these trailers or motels with barbed wire on the outside stopping you from getting out. You have to do these things for yourself and for your family. Again, what do you do? And this gets asked a lot on this channel. What do you do if you have a child, an elderly person, a family member, a loved one, a roommate who gets sick? Well, if you're staying in that same home, we have to look at reality versus ideals. Ideally, you would have perfect climate outside. You would have a tent erected outside. That person would go into that sick tent. They would have everything they need there, and they would be able to take for themselves, and then they would get better. That's a perfect world. In an imperfect world, you don't have great climate outside and everyone has to stay inside. So here's what you need to do. This isn't a comprehensive list. This is just some things that you can do to help yourself and your family. Number one, make a sick room. Designate a sick room. In this sick room, you're going to want to keep the windows open, and you're going to, as climate allows, of course, and you're going to want to keep a fan on the inside pointed toward the outside so that the inside air gets pushed outside. This is, of course, if you can't have negative pressure in the room, and let's face it, not everyone is going to be able to. But most people can purchase a box fan and put it into a window and push that sick air outside where it can be dispersed. That's the game here, dispersal. Have a method for delivering goods to the people in the sick room. First of all, this sick room needs to be semi-autonomous. It needs to be semi-self-sustaining. That means you need food and a way to cook that food in there. You need water and a way to replenish that water. You need medicine that the individual can take within there. Semi-autonomous, semi-sustainable. So create a box, and inside that box, don't put all of your medicine, but put enough for however many people are sick for a week. Because within a week, you're going to see progression or regression. You're going to see it moving forward and getting better, or moving further and getting worse. Make sure that they can self-medicate for that amount of time. Children, of course, are a different story. Maybe the elderly are a different story, or people with special needs, and each person is going to have to craft their own plan in these circumstances. But for now, make a box that has enough medicine in it that can be self-administered by the people in the sick room to reduce, and this is what the game is about, reducing the exposure to people who aren't sick yet. First of all, a number of people are going to be asymptomatic. Make sure that your plans are fluid and the asymptomatic carriers can care for other people. Okay, next, further isolate by placing a plastic barrier outside of the sick room. Get some 3mm plastic, tape it up, do whatever you have to do. You say, Brad, I don't want to ruin my drywall, I don't want to ruin my paint. Oh well, you don't want to get sick either. So you're going to have to do these things that are uncomfortable and look a little bit overwhelming, but you're going to get through. Tape it up, cut it down the middle, and then you're going to use this area to pass. That's so that you can bleach it down. You can decontaminate this easily after. Further isolate. Make sure you have a method for delivering food to individuals. Knock outside the door. After 1 to 2 minutes, the people can come and open the door and get it. Decontaminate that shared area after that. You're going to have to do this each and every time exposure is made. Get 2-liter bottles or anything that can be filled up, old milk cartons, although you're always going to have a milky taste in there. It's going to be soaked in there. But do your best with what you have. Don't use things like bleach bottles. Use things like 2-liter bottles, gallon water bottles, 5-gallon buckets. Make sure that you have enough water that the person can remain hydrated and can get better. Make sure they have vitamins in there. Make sure that if you're going to continue to share a bathroom, that the sick individuals cover their mouths and their nose every time they go to the bathroom, every time they walk into that shared area. And then it's the healthy person's job afterward, decontaminate the entire bathroom, everything they might have touched. You have to be a little bit overbearing about it. You have to be a little bit obsessive about it. Hupel's cat has a great way of looking at this, and he tells this as a nurse. Make sure that everywhere that might be contaminated in your mind, imagine it is covered in red jelly or red jam. So each time the sick person goes from their sick room to the bathroom, they have just covered that entire area, the hallway, the doorway, the doorknobs, the sink, the toilet handle, the seat, everything in there that might be touched by another person is covered in red jam. So now it's your job, the job of the healthy, to go after them and cover and clean all that red jam off. You're going to do this with 1/4 cup of bleach to 1 gallon of water. Spray it down, make sure that it's well decontaminated. The doorknobs, the handles, they might have just put their hand over on the wall. Because they're sick, they might not be feeling good and needed time to take a breath. Touch the paneling, the sink, the toilet seat, the toilet handle, the top of the toilet. Each one of these things you need to take into account for and decontaminate it. This isn't easy and it's not pretty. It's not a glorified task, but it's something that if you're serious about not sharing this illness, you're going to have to do. Ensure that the person who is sick gets rest. Make sure that the ill can take their vitals, and this is really important. I have a sheet here. This went out on one of our Patreon send-outs months ago. This is a vital sheet. Start thinking about it now because you want a baseline to go off of. Make sure that they have a quick thermometer, something that can take a temperature in just a couple of seconds. I like quick thermometers like this that can be put under the arm, it can be put in the mouth, it can be used rectally if you have to. Easily decontaminated, better than forehead. They're just not, maybe it's because I have a Neanderthal ridge over my forehead and I can't get an accurate reading by going over the top. Whatever it is, I don't like those as much. I like these. Also, make sure that they're taking their blood oxygen level, taking their heart rate, taking their blood pressure, and you're going to keep it right here on a chart like this. This has date and time, name and weight, blood glucose, if you can take that, ambient temperature, so the temperature inside of the room, what the person's pulse is, their SpO2 or their blood oxygen, their blood pressure, their body temperature, their stress level, and their workload. If they're in the sick room, their workload better be down to 0 or 1. Their stress level, they need to indicate for themselves. Make sure that you make a chart like that and that individuals can use it. Every time contact is made, decontaminate. Don't forget, 1/4 cup of bleach to 1 gallon of water. Remember, the source links are in the first pinned comment. Share this video with other people. What if someone that you share it to, them just hearing over and over again the repeated nature of 1/4 cup to 1 gallon of bleach, or 1/4 cup of bleach to 1 gallon of water? Remember, you can't drink that. That is just for decontamination. What if them just hearing this over and over again sinks into their head and they end up saving their lives or someone else's life by this, an elderly person? It's important. Please share it with other people. Share the source links also. Make sure they know that the source links are there. Guys, thank you for being here. Subscribe, hit that alarm icon so you get alerted every time a new video comes out. We're only here because of people like you. Remember, if you have $10, get a bag of rice. If you have $10, get canned food and over-the-counter medicine. If you still have $10 and you want to support what we do, patreon.com/full spectrum survival, and we send out every single month physical survival cards. Until this disaster is over, it's going to be based on biological threats. Each month, 5 cards and a newsletter. We try to give back to you for supporting what we do here. But remember, if you have $10 to spend first, put it towards rice, canned food, medicine, readiness. This week's Full Spectrum News is brought to you in part by each one of our members on Patreon. Starts at the $1 level if people just want to go there just for the community and the discussions. And by USABerkeyFilters.com. We have a Berkey here. The Berkey Blacks use such a concentration in that filter that it can filter out viruses. Use the code FSS10. You'll get 10% off your order. PowerTac, POWERTAC.com. They create military and police flashlights for civilian use. We have them here. If I hear something at night and I think someone's getting into my decontaminating goods that I've purchased online, I want to be able to light it up. For a special time only, a limited time, use the code FSS40 to get 40% off of the lights. They have a lifetime hassle-free guarantee. And surviveware.com. They create first aid kits for the homesteading, off-grid, and survival community. Use the Amazon link or their website. Full SS10 gets you 10% off of the packs. They have waterproof packs, which I really like. From my family to yours, please stay safe, remain vigilant, and keep watch.